Hi, everyone. Welcome to the IRB session. Thank you all for joining. Today we have Julia Kennedy, who will be conducting the IRB session on conducting research during the COVID-19 pandemic. So I will, let Julia start the presentation since, I know everybody's a little tight in terms of time. So Julia, thank you for, presenting this important topic to us. So you can, start the presentation.
Thank you so much, Renat. And thanks to everyone for joining today. Today we're going to be talking about IRB submission tips for conducting research during the COVID-19 pandemic. And just a quick note, the presentation today only addresses the regulations at 45 CFR 46, but be aware that other regulations may apply and require different determinations. So for example, if you're conducting FDA regulated research using protected health information, then HIPAA would apply. You're transmitting protected health information electronically. So I'm going to try and steer clear of that. So there are standards that must be satisfied for the IRB to approve human subjects research. And these criteria for IRB approval are described in the Common Rule at 45 CFR 46. And the Common Rule is a short name for the Federal Policy for the Protection of Human Subjects, and it was adopted by a number of federal agencies in 19. And the Common Rule is the baseline standard of ethics by which any government-funded research in the U.S. is held. And nearly all U.S. academic institutions hold their researchers to these statements of rights, regardless of the funding. So these are the criteria for IRB approval. The IRB needs to determine that the risks to subjects are minimized, right? Subjects should not be unnecessarily exposed to any risk. The risks to subjects are reasonable in relation to anticipated benefits, making sure there's an adequate risk-benefit ratio. The selection of subjects is equitable, making sure there's a diverse subject populations being targeted and the recruitment procedures are appropriate. Informed consent will be sought from each prospective subject to the extent required by the regulations at 116, which talks about a consent process and the elements of informed consent, so the things you need to tell subjects. Informed consent will be appropriately documented or waived in accordance with the requirements at 117. These requirements talk about the need for a signed consent form or cases when the IRB can waive the requirement for signed consent form. When appropriate, the research makes plans for monitoring the data collected to ensure the safety of subjects. So this comes into play with research involving greater than minimal risk. When appropriate, there are adequate provisions to protect the privacy of subjects and maintain confidentiality of data. When some or all subjects, and for that one, so when we're talking about privacy, we're talking about researcher interactions with subjects. And when we're talking about confidentiality, that's how researchers will keep the data secure. And then of course, when some or all subjects are likely to be vulnerable to coercion or undue influence, such as children, prisoners, individuals with impaired decision-making capacity, there need to be additional safeguards in place to protect the rights and welfare of those subjects. So IRB needs to ensure that all of these criteria have been satisfied in order to grant approval. So the criteria for approval have not changed as a result of the COVID-19 pandemic. However, remote research procedures have become more commonplace. So I thought what we could do today is look at some questions that the IRB may ask related to criteria for approval, as well as researcher considerations and information that may be helpful for the IRB to have when reviewing research that involves remote procedures. So let's start off by talking about risk to subjects. So risks to subjects need to be minimized. And these are some questions that the IRB may ask when determining if this criteria has been satisfied. Have the reasonably foreseeable risks been identified and described in the IRB submission? Are the procedures necessary, or are any already being performed for reasons other than the research? So for example, if subjects are if a blood draw is needed for research, and perhaps these subjects are already undergoing a routine blood draw as part of their standard care. Is there a way to tag on that research draw to the standard care to only expose the person to one stick as opposed to multiple? What are the precautions to decrease the likelihood and magnitude of harms? And are there contingencies to deal with harms if they do occur? And are adequate resources available to protect subjects? Now, the IRB then also needs to determine if the risks to subjects are reasonable in relation to anticipated benefits. And when we're talking about benefits, so it includes physical, but it's not limited. There's also potential psychological risks, reputational, social, financial. For example, with social behavioral research, perhaps it's a focus group talking about sensitive topics. Feelings of stress or guilt or embarrassment may arise based on the particular topic, particularly when it's sensitive. And it's also, I think, important to keep in mind for social sciences research that involves an element of deception, that particularly deception that includes false feedback to the subject about their own performance may involve psychological harms. And those should all be outlined in the IRB submission. After understanding what the magnitude and likelihood of harms is, the IRB is going to want to also question what's the prospect and significance of any direct benefits. And there isn't always a direct benefit, and that's okay. If there's not a direct benefit, I'm sure there's other potential benefits to society, and those should be described separately. So what are some things that the research team can consider addressing in their IRB submission in terms of minimizing risk? A guiding COVID-19 risk mitigation principle is minimizing face-to-face contact where you can. So using remote procedures where you can throughout the research, whether it's during recruitment, obtaining informed consent, data collection, distributing subject payment. I think because things keep changing, there's so much change occurring during this time, if possible, you can outline in your submission plans for when it's okay to have these face-to-face interaction subjects. Here's the procedures for how we're going to do things. But then have a backup plan, to be able to switch to remote for when you need it. In cases where face-to-face interactions are not possible, here is what the protocol that the study team is going to follow for conducting procedures remotely. So I think that's, an option to kind of, if you're able to address both pathways in a submission, kind of thinking ahead about things. It's also important to keep in mind any institutional risk mitigation plans in place at Kean University. Typically, these plans outline requirements for being on campus. If any precautions need to be taken place, those need to be followed. And these plans may also outline fluid criteria for when to permit or not face-to-face research interactions or other stipulations regarding human subjects research. So it's important to always kind of stay abreast as to what the current institutional risk mitigation plan allows for in your institution. And then beyond that, there's also considerations of restrictions or requirements that may be in place at the national level, regional level, or even, when you're conducting research off-site. So for example, if a Kean researcher is looking to conduct research in a local public school, the IRB is going to want to know what are the restrictions and requirements in place at that school, and how is the study team going to meet those expectations? What's the plan in place to monitor for changes in the requirements at that site? Just to make sure that, again, basic requirements are being followed.
Hey everyone, it seems like it might be that time to raise an alert for your students. So I'm going to go through the steps for doing so in the faculty dashboard within Advise. It is important to note that alerts can be raised in one of three ways: by the student through automated systems.
And then finally, it's just important to note that the IRB retains the authority to require more stringent risk mitigation plans. So, If the IRB says that a particular protocol or type of protocol may not at this time include in-person interactions, then that would need to be adhered to. Okay, so now I thought we could kind of move on and talk about different examples of remote procedures along with those IRB considerations for criteria for approval. So there are many ways to recruit subjects remotely. This could involve contacting potential subjects by email, letters, phone calls, Research Match, which is an NIH-supported site where folks can go and sign up and indicate that they're interested in participating in certain types of research. You can also do direct advertising by using flyers, websites, posting ads in different forms of media. I think what's important, again, this is for any recruitment proposal, check your IRB policies regarding recruitment, including the type of information that must be included and should be avoided for your recruitment materials, because that's going to apply no matter what form of media is being used. So for subject recruitment, here are some questions the IRB may consider when determining if the selection of subjects is equitable and adequate provisions are in place to protect privacy during recruitment. So the IRB is probably going to ask, are the screening and recruitment procedures appropriate? They're going to want to know the setting, the location, the timing, the population that's being targeted, and how they're going to be accessed for recruitment. They're going to ask, do the methods ensure diversity in recruitment? So to promote an equitable distribution of the risks and benefits in research, a diverse population should be targeted during recruitment. And this may require a variety of methods to reach a diverse enough audience. The IRB is also going to ask, are the recruitment materials easily understood and free of any exculpatory language and undue influence? And then in terms of determining if there's adequate provisions in place to protect the privacy of subjects, the IRB is going to consider the settings where recruitment will occur, and if there's provisions to ensure privacy when contacting and interacting with subjects. So careful consideration should be given to how people are approached, the setting for approaching subjects, and the level of privacy needed to conduct this discussion about research participation. So what are some things that the research team should consider addressing in their IRB submission for remote recruitment? I was going to talk about two examples. So one being direct recruitment emails and then using social media.
Okay.
So
IRB
for direct recruitment by email, the IRB submission should address who's going to be sending the emails. Is it going to be someone from the research team, or is someone sending these emails on behalf of the research team? And also the source of the email list. How is the research team obtaining access to these emails? Is approval needed? Who's the targeted population of the email? Here, care should be taken not to disclose the identity of recipients to others. Avoid group emails, or be careful don't use CC, use BCC instead. You want to avoid the potential for someone to make a mistake and accidentally reply to all, because then you're disclosing information, whether it be someone's others' email addresses or their discussions to others, which is definitely invasion of their privacy. And I just wanted to mention too, it's important to pay attention to the population. So for example, if children are being targeted with recruitment email, consider that the emails might be seen by others, since children may not have complete control of their email. The IRB submission should also address the frequency and total number of emails that will be sent, and how individuals can opt out from receiving additional emails if that's possible. I know sometimes the way that these automated messages are set up, it may not be possible to remove individuals from the list once it's established. And if that's the case, then describe that in the IRB submission, or I'm sorry, the email correspondence that goes to potential subjects. So let them know, after this initial recruitment email, we plan on sending 2 more within the next couple weeks. Unfortunately, we cannot remove individuals. Please delete those emails when they come through if you're not interested in participating. And of course, make sure that you include the complete email text in your IRB submission for review. Just like with any other recruitment materials, all content should be included, along with any images, the subject line, all the text. And when it comes to the subject line, I recommend making sure that it's research specific. So say something like seeking participants for a research study or information about a research opportunity. So folks know what the message is like. Remember, this is direct recruitment. So it's not like these folks have contacted you in advance saying that you're interested in being in the study, but rather researchers are kind of like reaching out to people directly, like a cold call where they're not expecting it. So I think it's important to be transparent and clear right in that subject line, give people the choice of whether they want to click to read more. And also avoid information specific to any targeted condition in that email subject line. For example, don't reference health conditions. You don't know who's going to walk by someone's inbox and see what's in that subject line. Also in the email text that goes to potential subjects, reference and describe how you receive their email. You could say something like you're receiving this email because you're a student at Kean University and your email address was obtained from, and then wherever it came from. Just again, so folks are understanding like, how do these researchers get my email? Why are they contacting me? It's important to be transparent. So now I'll talk a little bit about using social media for recruitment, which is very common. So in the IRB submission, name all the sites that you're going to be recruiting from, whether it's going to be Facebook, Twitter, something else. Each of these sites has its own terms of service and policies. So it's important to know exactly where this is going to occur in order for the researcher and IRB to make sure that all requirements are met with that particular site. I recommend describing the account type that's going to be used on the social media site. Is this a Department of Education research account that's going to be making any of the posts or used? I recommend avoiding use of a personal account because this work is occurring on behalf of the university. It's not a personal activity. That can be misleading. The targeted population should be described. How are you going to obtain access to these folks on the social media sites? And along with the frequency of any posts or tweets that will be made. And again, all research initiated posts and the planned responses need to be submitted to the IRB for review, including the text, the images, everything. The IRB submission should also describe the type of recruitment. Is it going to be passive and or active? So with passive recruitment, it's the one-way ads or banners that don't involve direct communication with potential subjects. If someone sees it and they're interested, they click, they contact the research team. With active recruitment, the research team is reaching out to potential subjects, like using Facebook messages or Twitter direct messages to interact with folks to initiate subject recruitment. And in these cases, the IRB submission should describe how potential subjects will be identified, approached, and their privacy maintained during those recruitment discussions. So the submission should also address whether the recruitment methods are in line with the terms of service of the social media sites and any applicable federal and state laws. So if the research team is proposing a recruitment technique that is not in line with the terms of service, I recommend that the researcher reach out to the website and request a written exception from the site saying that's okay to use for the proposed recruitment activities. Because that way you're kind of covering, there's a variance there, it's typically not allowed, but the site was granting approval for this to occur. In terms of federal and state laws, it's important to be aware that there are laws that govern social media recruitment activities, and investigators and IRB should determine which of these federal and state laws are applicable to a particular social media recruitment activities and ensure compliance. So some examples are COPA, which is the Children's Online Privacy and Protection Act. So this applies to websites directed to children under the age of 13. that collect identifiable private information. There's additional requirements there. One of them is needing parental permission first before you can reach out to kids and collect their information. And again, if you're using health information protected under HIPAA, there's HIPAA requirements. There's high-tech requirements, which is the health information technology for economic and clinical health that applies to transmission of health information online. So just be aware that there's other requirements. And also, if the research teams are going to be doing recruitment in group settings, like social media group settings, it's important to obtain permission from the group administrator prior to doing any posting or joining, chats or conversations. Again, it's part of being transparent. These individuals are in these groups for a particular reason. They're probably not expecting a researcher to be joining and participating in their discussions or posting things. So, obtain a documentation from the group administrator that it's okay and keep it on file. And finally, just in thinking about using social media for recruitment, I think it's important to remember that just because folks are interacting online does not mean that there's no expectation of privacy. So there's even more and more research is starting to be conducted on this topic to help us better understand privacy concerns when using social media as a recruitment tool. And there was one recent study titled Public Concern About Monitoring Twitter Users and Their Conversations to Recruit for Clinical Trials. So they posed questions to individuals to see how they would feel kind of about using Twitter in this way to recruit subjects. And findings from that study showed that in general, the privacy concerns about Twitter monitoring for research recruitment were similar to privacy concerns in offline recruitment scenarios. In that study, a small majority of users did not think that monitoring Twitter for clinical trial recruitment constituted inappropriate surveillance or was a violation of privacy, while others indicated agreement that social media monitoring constitutes a form of eavesdropping that evades their privacy. So hopefully there'll be more research conducted on this topic in the future, and we can get a better idea of understanding of what people think about using social media for recruitment. I think just some important tips are to ensure that your recruitment strategy is sensitive to the privacy of potential participants, is respectful of the norms and the community being recruited, and will not undermine public trust in the research enterprise, including use of deceptive practices or a lack of transparency. Research teams should avoid methods that involve like lurking or creeping in social media sites in ways that members are unaware of, or recruitment advancements or contexts that might embarrass or stigmatize potential subjects. So just some things to keep in mind. So now we'll move on and talk about some proposals for conducting informed consent remotely. One example might be sending a consent document to potential subjects by mail or email, followed by a phone or video call for discussion. Another example might be displaying a consent document prior to a minimal risk online survey where the IRB has waived the requirement for signed consent and just ask subjects to click to confirm agreement to proceed. In that case, no signature is required. Another option might be electronic informed consent. Now, this is something very specific. So I'm talking about the use of electronic systems and processes that may employ multiple electronic media, including text, graphics, audio, video, podcasts, passive and interactive websites, biological recognition devices, card readers, all these types of things to convey information related to the study and to obtain and document informed consent. So there are very specific requirements for electronic informed consent, and these are outlined in federal guidance from the Office for Human Research Protections and the Food and Drug Administration. And there's also federal regulations at 21 CFR Part 11, which typically applies to FDA regulated drug and device studies, and has all kinds of requirements specific to verification and signature verification. So what's important to remember with electronic informed consent is it's required that, even not considering part 11, it's required to have a method to ensure that the signatures are legally valid within the jurisdiction where the research is to be conducted. So this is a, decision that's often made, in kind of in collaboration with general counsel at an institution to determine, how they're going to interpret that and say that this process is creating a legally, it constitutes a legally valid signature. And IT department involvement in those decisions as well. So there are tools out there that support electronic informed consent. I know that RedCap has one. There's others as well. But what these do is they provide standardized tools to obtain consent, to store consent documentation with a certification screen that automatically generates a hard copy PDF of a signed form, right? It's a valid electronic signature. And I think just some things to keep in mind if electronic consent is allowed at your institution, that when submitting to the IRB, I would recommend submission of both a PDF copy of your e-consent materials as well as a link to the actual content so the IRB can view the consent process as a participant, but still have that PDF documentation, right? Because you need to maintain that documentation for your files, which can be kind of tricky when you have all the content living online. So just something to think about with the e-consent, also needing to maintain that paper documentation as well. So here are the regular criteria that the IRB must consider when determining if the informed consent process is appropriate. And this is for non-exempt research. Will legally effective informed consent be obtained? Will the subject have sufficient opportunity to consider whether to participate? Does the consent process minimize possibility of coercion or undue influence? Will the information be in a language understandable to the subject or legally authorized representative? Will information that a reasonable person would want in order to make an informed decision be provided, along with the opportunity to discuss? Does the consent start with a concise presentation of key information to help think about why to participate or not? Is the consent organized in a way that facilitates understanding? Is the consent free of language that appears to weigh a subject's legal rights or release the investigator, sponsor, or institution from liability for negligence? And does the consent document include all the basic and required additional elements? So, right, describing this is research, these are the risks, the benefits, the experimental procedures, how confidentiality will be maintained. So that's what the IRB is looking for. So what are some things that research teams should consider addressing in the IRB submission? For sure, when obtaining informed consent remotely, you wanna, in your submission, make sure that you are clearly explaining the communication methods that are going to be used. How is information going to be exchanged? How can these discussions take place? This is, the crux of informed consent, is being able to have that dialogue and provide that information and allow opportunity for potential research subjects to ask questions. And it's important to remember that informed consent isn't always a one-time discussion either. I mean, if it's a study that only involves one time and then you're done, perhaps, but for ongoing studies, informed consent process should also be an ongoing discussion, especially when things change that may impact the subject's decision to continue participation. So describe those communication methods in the IRB submission. And, just some examples of, things that could be used. Discussions could take place by phone calls, video conferences, live chat. These could be potentially recorded, so subjects can refer back to them at a later time. But there's ways to do this remotely for sure. Also, when obtaining informed consent remotely, it's important to remind subjects to be in a private location to help ensure privacy and confidentiality. So it's different, right? When you're interacting with subjects in person and doing that recruitment, you can go in the private room and close the door. But here it's different because you're not aware of, the location or surrounding where the subject is when you're having these remote discussions. So when informed consent is obtained for non-exempt research, subjects must document consent by signature on a form unless this requirement has been waived by the IRB. So these are the three scenarios where the IRB can waive the requirement for a signed consent form. And the first one most often applies to social behavioral sciences research when it involves no more than minimal risk and only involves procedures that do not require written consent outside of the research. The IRB can determine that a signed consent form is not required. So when a signed consent form is required and informed consent is being obtained remotely, what are some ways that the research team can make sure that they get a copy of that consent form? Because the research team needs to have that signed consent form before any research procedures can start with the subject. So when consent forms are signed remotely, a subject could return it by faxing, taking a photographic image and sending it through secure electronic means back to the research team, scanning the consent form and returning it through secure email. A subject could mail the signed consent form back to the study team. And a subject could also bring the signed and dated consent form to the first study visit if that first study visit happens to be in person. And another thing to keep in mind too is that subjects must also receive a copy of their signed consent form. So making sure, all of this is addressed in the IRB submission. And finally, I'm going to talk a little bit about using technology to collect data. So there are many ways to collect research data remotely using web-based tools, mobile devices, electronic recordings. And it's important to keep in mind that greater security measures are required for sensitive data. So different tools may be approved for use depending on the sensitivity of the information. So for example, maybe like benign surveys where no direct identifiers are collected could, let's say, be done through Qualtrics, whereas if it's more sensitive information, maybe the institution requires secure REDCap. These are just examples. It varies institution by institution, which is why I strongly recommend following guidance from your IT security department to determine acceptable methods. What types of technology can be used when? And I think it's helpful to have this documented, right? So researchers and IRB members can refer to this document and know in advance, okay, for this level of sensitivity or for these types of identifiers, what tools can the research teams use? What's been vetted by our IT security department and they think it's okay in these cases? It's also important to remember that all methods must be approved by the IRB. So here are some items that the IRB may consider when determining if there's adequate provisions in place to maintain the confidentiality of data. So first, the IRB is going to wonder, well, how sensitive is the data? Again, the more sensitive the questions, the more security measures that are going to need to be in place to maintain confidentiality. Is the data that will be gathered and accessed necessary to achieve the objectives of the research? Never collect any data that you don't need to meet the research goals. So for example, if the research team is proposing to collect social security numbers, the IRB is going to ask why that information is needed to conduct the research. And it may be necessary, if it's not, it should be removed. Are there adequate provisions to minimize the risks associated with disclosure or breach of data? So here, the IRB is going to be looking for procedures such as, how is the data obtained? How is it recorded? How is it stored? How is it going to be transmitted? Will others have access to the data? Who are they going to be? Is data sharing going to happen? If yes, how is the data going to be transmitted? Will identifiers be included? Is a data transfer agreement needed for the sharing? The IRB submission should also describe if there's any plans for future or secondary uses of private identifiable information. If yes, then the IRB is going to need to know, well, where is that information going to be stored and maintained? What are the procedures in place for releasing that data? And then finally, the submission should address plans for data retention and destruction. So these are all things that the IRB is going to be considering when thinking about confidentiality. So, and I know there's a lot of different ways to use technology to collect data. So I was just going to talk about online survey tools, mobile devices, and electronic recording. I know there's many others that we could address as well, but when thinking about an online survey tool, it's important for the research team to name the provider, who it's going to be, what platform is going to be used in the IRB submission. As an IRB, I serve as an IRB member on other boards, and oftentimes I see protocols where it describes, we're going to do an online survey, and it never names what service provider is going to be used. So that's always a question that I ask. And it's important to know because, again, each of these tools is going to have different ways that they work and different security measures. The submission should also address, has the service provider for the research been approved by IT security department? Is this a particular tool that's been approved for this type of research? What identifiers and data will be collected? What about considering the platform settings and automatic collection of identifiers? Is there any of that to be aware of? There's a lot of platforms out there that automatically collect identifiers like IP address or email address, and sometimes the settings need to be adjusted in order to turn that off if the researcher is not proposing to collect that information. And then also addressing how the confidentiality of data collected on the web-based tool will be protected. So when submitting a research protocol that involves mobile devices, such as electronic tablets, cell phones, activity trackers, the IRB submission should address what mobile devices will be used and who's going to be providing the device. Is this a Kean University device? Is it provided by the sponsor? Are subjects going to be asked to use their personal device, like a phone? The submission should address if the proposed devices are something that's been approved, cleared by the IT security department. Any procedures for physical and electronic security of the device. Outlining how data will be securely transferred from the device. Will it be encrypted? Will an app be used to get the data off the device? If so, some of these apps require that subjects may log in and have to create an account for the app. If that's the case, then that should be described in the submission as well, along with what identifiers or data will be collected on the device and how confidentiality of that data will be protected. And finally, electronic recordings. So another way to collect data remotely. The IRB submission should describe the methods that will be used to either record images, video, or audio, and has use of the recording method been approved by the IT security department. Perhaps you have like a HIPAA compliant Zoom or something like that that's more secure for having those, like informed consent or research discussions with subjects to collect data. The submission should describe what content will be recorded, if the recorded information will be transmitted over the internet, and if so, how will it be kept secure? How will the information be secured to protect against unauthorized viewing or recording? Will files be saved on like a IT department server? And if using an outside vendor, have the required agreements been executed? So an example here might be, for a focus group was recorded and the recordings are sent out for transcription to a transcription service that's been established, that's Kean approved. So that would be an approved method, but if a research team wants to use a different service to do the transcription, perhaps there's other requirements at Kean that need to be taken care of first before that new vendor could be used. So just some things to think about. So in conclusion, there are certainly a lot of moving parts right now, and the pandemic has presented challenges for conducting human subjects research. If it helps at all, one constant is that the IRB criteria for approval, again, they haven't changed. I think it's helpful to keep them in mind when preparing your submission, just kind of understanding what questions the IRB is probably going to ask and being able to anticipate the types of information that's needed about tools, technology, and remote methods and procedures being used to help out with that IRB review. And that's all I have.
Thank you, Julia. Now I'm going to open the floor for questions.
Okay.